if you remove the fascia from the muscles, no, the muscle become like sand.
It can flow up.
If you read like muscles physiology, the muscle is designed by only actin and myosin. And what is the actin and myosin? It's just protein. Protein is like sand. Each and everything is holded by fascia. If you remove the fascia, then sand. Okay? So it's the fascia.
So what is muscle loss? Muscle loss is when there's not fascia there?
No, muscle loss is comes
Physical
from.
muscle is reduced.
Okay? So
So that covering, when we open this egg, boiled egg, then
white layer.
this white layer, that is the fascia.
that is I am going to.
So that keeps it.
This
in-
one,
yeah.
this one, here.
Yeah.
Okay?
Onion.
The very good example, which is the orange, because orange is exactly muscles. Each and every fruit are connected with some specific part of the body in our human body. What we have more, which vitamin is more in the orange?
C.
C. And what is the productions of the what will do the C more?
Collagen
Produce the more collagen. Where we use the more collagen?
for the muscles.
In the muscles, in the disc, in the cartilage, the eyes, and hair.
There.
Okay, so that's why giving the more logic muscles connected with like vitamin C. So see, if you see the first layer of the fascia, which is the pure like white layer. Okay, the first there is 3 layer of the fascia. When we are inserting needle now, this fascial layer is more important.
Okay.
Okay, whenever we insert the needle, 3 fascia. What is the function of the 3 fascia? One fascia will give you contraction. The upper layer of the fascia is contracting, no? Then lower, the second deep fascia will release. Understand? Then third fascia will balance your movement, contraction and relaxation. One fascia is contracting, second releasing, and this fascia will balance your contraction and relaxation is normal or not. And whenever this fascia will release, then this will contract. Understand?
Once
Now-
more.
Yeah.
Once more.
There are 3 layers of the fascia.
Okay.
It's called like superficial fascia, deep fascia,
Middle.
and visceral fascia. Okay? In the muscles also, mostly visceral fascia called around the organ which fascia we have, that is a visceral fascia. Okay? But in the muscles also many writers they suggest visceral fascia, which means balancing fascia. Okay? So superficial fascia,
Top layer.
if contracting, then deep fascia will release.
Okay.
Understand? The contraction and
Deep
the relaxation.
Relaxation.
And visceral fascia will balance your contractions capacity and relaxation capacity. Understand? So whenever here in the sense we have the 3 fascia. One around the wall, orange. Okay? When we going to open the orange, this is the muscle. This is the muscles. Again we have the second fascia.
Then
The first fascia was on the top. Second fascia is here. And we are going to open this. Each and everything is
Connected.
holded by fascia. Alright? For example, if we remove this fascia, then this muscle will divided in a small teeny part. If you remove this, then your muscle will be open. Each and every muscle are not supporting each other.
Okay.
This is the fascia for all group. Now for cardiocep, no, all cardiocep muscle having the one fascia. This is rectus femoris, vastus lateralis, vastus medialis, and vastus intermedialis. This fascia is holding your full group of the muscles. If you remove this fascia, then these muscles are not supporting
they're
each
all
other.
separate.
Okay. If you remove this fascia, then inside the muscle is not good enough strength. Okay. So for example, now if you remove this fascia, then your all muscle become like this, the small sand. Understands? So when we are going to insert the needle, no, the depth of the needle is more important. For example, if your superficial fascia is weak and you are inserting needle inside the deep fascia,
Useless.
Where is the result in needle, you know? There are two muscles now. One, rectus femoris. Below the rectus femoris, which muscles we have?
Intermediaries.
Vastus intermediaris. So if we want to insert needle in the vastus intermediaris, then of course we are crossing through
Superficial.
the rectus femoris. What do you think? We are treating the rectus femoris too? Is the rectus femoris getting treatment?
Origin.
No.
Sub.
Where we will leave the tip of the needle now,
That is what is.
that is more important. On the express highway, many buses are going on. Many bus goings. There's not uses for local villages.
Yeah.
The use of the local village, which is the local bus will come.
Very true.
They will stop there, they will take the inside, right? So exactly same, if you are crossing the muscles, nothing will happen. Okay? Where we will leave the tip and we are giving the stimulations and that sensation going on the tip of the needle now, you will get treatment only on that area. Got it? So we have to learn first how we'll know we insert needle on the superficially or little bit deep or again the deep. Okay. The second, the directions of the needle is more important. Okay, because each and every muscles having their own directions. The filament is designed by one directions. Okay, like the filament is going like this, some filament is a little bit crisscross, some filament is on the side way. Okay, so always will go the cross of the filament. For example, now this is the muscle. This muscle is contracting like this, right? This is a muscle like this. If you are inserting needle here and going like with the filament, if you are inserting needle here, just you are crossing one filament, and you are just going with the muscles, it will not respond that far. If you are going like this cross, then you are crossing many filament. Got it? If you are inserting needle like this, you are going between the gap. Maybe if you will go, you are going on the top of the one filament only. That is not that much effective. But when you are going like cross, you are crossing the whole filament. They will get the more treatment in that area. So we are not using anything extra,
You mean transverse?
yeah, the crossings. Okay, so we are not using anything for the pain management. We use the patient's own essence or material what the patient's having. For example,
Stimulate.
if your muscle is weak here, if you are inserting needle there, before the inserting needle, the circulation is not enough there. When we insert the needle is giving the lots of the stimulations in your body, okay, and the fascia will collect the more collagen in this area.
For insertion of needle, what is more important? It is filament important or this point where we have to.
In the muscles, we will not use acupuncture point.
Right.
We'll use the trigger point.
Yeah.
Okay. We'll
Trigger point are these filaments.
we'll discuss little bit. Give me just few minutes. And okay. Yeah, because I want to explain that's little bit in from the deep. Okay. So actually, meaning of the trigger point is very many people are explaining different their own way. But as per me, what I understand and what I am getting the result from the patients, I am very thankful and very believe with that systems. Okay. So same, for example, when we are cutting the tree, then many new branches came out. For example, I bought here the 7-8 tree, which the height of the tree was like this. Then my gardener came and he cut from the center of the branch. I become very sad, like, why you did like this? And you'll see now. When he cut like this, then there is 12 new branch came. Before there was only one. New 12 branch comes. Exactly like same when we are, but it's purely depends, some tree when you are cutting that will not grow again. Some tree when you are cutting they will grow very beautiful. What is difference between that two, you know? If you are cutting with a sharp axe, kuladi axe se bolte hain usko. If you are cutting the tree with a sharp axe, the tree will grow more beautiful. But if you are cutting with the sharp is the axe is not that much sharp, which means you are breaking the tree. I have both example in the garden.
Tissues get more damaged.
Yeah. Okay. If you are cutting the properly, the body will develop more. But if you are hurting, like you are damaging,
Tissues.
so it's pure like it's pure depends on your stimulations. Okay. So in healing systems we use one word. Patient body is organism, not mechanism. Okay, designed by organ, small cells, not through the screw and these holes. Okay, so we don't need the hammer to fix that. We need the mild stimulations. The mild stimulate will heal your body because everything will happen itself. Body will heal itself. We are giving just sensation. Here is the problem. Just heal this because when muscle become the weak, no, what will happen? When muscle become the stiff, muscle giving too much sensation to brain, and brain give too much kind of collagens and many things here, but this muscle is not able to absorb that all. Whenever muscle become the weak, no, the sensation from the muscles to brain it becomes very less. So that's why this part is not going to heal. Weak muscle, the sensation from the muscle to brain they become very weak. So that's why brain is not focusing more on the weak part. Okay, when we'll damage this and we'll give stimulation to brain, here is the problem. Then brain give more sensation here, brain will bring the more fascia here. Okay?
Yeah.